Fellow Kenyans, let me now say a few things about home-based isolation and care that we have talked about before. While the World Health Organization recommends that all laboratory-confirmed cases of COVID-19 be isolated and cared for in a healthcare facility, it also recognizes that not all cases can be cared for in a health facility when the numbers begin to rise, and that prioritization of hospitalization and alternate care systems need to be explored and considered. As you are aware, due to our rising numbers of COVID-19 cases, it is increasingly becoming untenable to isolate all patients in our health facilities for management and care. We are glad to inform you that today we are launching our home-based isolation and care guidelines for patients with COVID-19. This guideline is available on the Ministry of Health website, and I encourage you to look at it, download it, and look at it so to get a clear understanding of what it entails. This protocol has been developed to provide a solution in the management of the increasing numbers and the anticipated surge in COVID-19 cases. Currently, according to the available data that we have, 78% of infected persons, that is, positive cases, admitted in our hospitals are either asymptomatic or mildly symptomatic, and therefore can be managed at home, provided proper laid-down procedures are followed. The home-based isolation and care guidelines dictates these procedures. The guidelines expound on key areas that include eligibility, care procedures, medical monitoring, referral system to health facilities when the need arises, criteria for determining recovery, and community participation, among others. The implementation of the guidelines shall be done under the supervision of medical and public health officials. Community health volunteers will be involved in the daily assessment of home-based patients and will be the key link between healthcare workers and the households. Home-based care in informal settlements, where households share small spaces, will require identification of institutions within the community, institutions that meet the recommendations for providing such care. And we are working on identifying such institutions within the community where such home-based care can be provided. And herein, we will also be drawing upon the Nyumba Kumi initiative in such settings, for they certainly have a role to play in supporting the care in the community. To succeed, the Ministry of Health appeals to non-governmental organizations, for they are very much involved and work at the community level, as well as others and well-wishers to partner with us in this fight against COVID-19. Implementation of these guidelines begins immediately. I therefore urge all stakeholders involved in the care of COVID-19 patients to adhere to these guidelines and ensure that it cascades to all informal caregivers of these patients in order to ensure delivery of quality services to our citizens.